A collapse. What is a collapse? It's when the paraglider closes. And it's called a forced collapse because it happens unexpectedly. Usually, collapses are caused by turbulence. They're not necessarily the pilot's fault. They happen due to external factors. For example, a very strong thermal followed by a sudden sink can make the paraglider collapse. Or, if you enter a rotor, the paraglider might collapse as well. So, the first thing to understand about a collapse is that the paraglider will close and then reopen. That means you need to stay calm. Step 1. Stay calm. Most accidents involving collapses happen because the pilot panics. If you panic, you might overreact and accidentally put the paraglider into a stall or spin. So, step 1, stay calm. Step 2, help the paraglider correct its course. Most collapses are asymmetric. What does that mean? It means that the paraglider usually collapses on just one side. It's very rare for it to close completely. It almost always happens on one side. And when one side closes, it slows down, causing the glider to turn in that direction. Our goal is to stop that turn. How do we do that? By using our body. For example, if I'm flying and the collapse happens on my right side, the glider will turn in that direction. So, I need to shift my body to the opposite side. How do I use my body correctly? By using my legs. If I want to shift my weight to the left, I should place my right leg over my left leg. That way, I move my entire hips, causing a weight shift that helps the glider correct its course and reopen quickly. Older paragliders, let's say those that are more than 10 years old, used to collapse, reopen, but sometimes leave a small fold, like a tiny ear. In that case, once the pilot corrected the heading, they needed to pump the brake. Strong, deep, and quick pumps. Not holding the brake down, but big, firm pumps. That helped the paraglider fully reopen. But with modern gliders, this is no longer necessary. The glider will collapse, correct its course, and reopen on its own. Now, let's practice a simulated collapse, but in a very small and controlled way by making an ear. An ear is basically a tiny collapse. So here's what we're going to do. While flying, I'll tell you when to pull an ear, but only on one side, not both. You'll hold that ear, let the glider turn, and then shift your body to the opposite side while keeping the ear in. If you release it too soon, it will reopen immediately. One very important thing to remember, we're using ears just to simulate a collapse. Some students get too focused on ears, and when they experience a real collapse, they think pulling ears is the way to fix it. No! The correct way to fix a collapse is shifting your body to the opposite side. We're only using ears to simulate the collapse.